Welcome to NCLEX Map, your top NCLEX preparation source. Today, we delve into HIV, exploring its pathophysiology and clinical applications. We'll use a case-based approach and tackle high-level NCLEX-style questions. HIV targets the immune system, specifically CD4 T cells, and if untreated, it reduces CD4 cells, increasing vulnerability to infections and cancers. HIV progresses through three stages: acute HIV infection, clinical latency, and AIDS. AIDS is diagnosed when CD4 counts drop below 200 cells, M3, or when opportunistic infections occur. Consider a 25-year-old male with a 3-year HIV history, presenting with symptoms like dry cough and fever. He stopped ART after job loss, highlighting the importance of adherence. The patient's respiratory rate is 28, with SpO2 at 90%. CD4 count is 178 cells, MM3, indicating AIDS. Elevated UBC and other lab values are noted. A BAL was performed, with cytology pending. The question asks which cell type HIV primarily targets. The correct answer is CD4 T cells, as HIV weakens the immune system by destroying these cells. To confirm progression to AIDS, a CD4 count below 200 cells, MM3, is critical. This, or an opportunistic infection, confirms AIDS. Pneumocystis jirovecii pneumonia is a common opportunistic infection in AIDS, highlighting the need for vigilant monitoring and timely intervention in affected patients. HIV diagnosis is confirmed through a Western blot test following an initial ELISA. This ensures accurate diagnosis and appropriate management. Understanding diagnostic procedures is crucial for effective patient care and management in clinical settings. The most critical nursing intervention for a newly diagnosed HIV patient is education on transmission and ART. Early education fosters treatment adherence and prevention, empowering patients to manage their condition effectively and reduce transmission risks. HIV is primarily transmitted through blood and sexual fluids, including semen, vaginal fluids, rectal fluids, and breast milk. Understanding transmission routes is essential for prevention and education, reducing the spread of HIV in communities. Antiretrovirals are the first-line medication class for HIV treatment. ART includes reverse transcriptase inhibitors and integrase inhibitors, among others, to manage the virus effectively. This knowledge is vital for healthcare providers in prescribing and managing HIV treatment. The goal of ART is to suppress viral load and preserve immune function. ART reduces viral replication, delaying disease progression and improving patient outcomes. This underscores the importance of adherence to ART regimens for long-term health benefits. For a client with HIV presenting with weight loss, night sweats, and oral thrush, the priority is to assess CD4 count and start ART. These symptoms are AIDS-defining, requiring immediate evaluation and intervention to manage the condition effectively. An undetectable viral load indicates that ART is working effectively. While the virus is not cured, viral replication is controlled, reducing transmission risk and improving patient health. This highlights the importance of regular monitoring and adherence to ART. For clients with HIV, eating well-balanced meals is crucial to support immunity. Proper nutrition aids in maintaining energy levels and immune function, playing a vital role in overall health management for individuals living with HIV. TB screening is critical for HIV clients, as TB is more likely to reactivate in immunocompromised individuals. HIV weakens the immune system, increasing the risk of TB, making regular screening and preventive measures essential in patient care. In a client with HIV developing confusion and seizures, encephalopathy is suspected. HIV-related neurocognitive disorders, including encephalopathy, require prompt diagnosis and management to prevent further complications and improve patient outcomes. An undetectable viral load best indicates ART effectiveness. Suppressed viral replication shows ART is working, reducing transmission risk and improving health outcomes. Regular monitoring is essential to ensure continued effectiveness of the treatment. The role of the nurse in HIV care includes monitoring labs, educating, supporting, and advocating for patients. Comprehensive nursing care is crucial in managing chronic illnesses like HIV, ensuring patients receive holistic and effective care. Recognizing signs of respiratory failure in immunocompromised clients is vital. Understanding HIV progression, responding to lab abnormalities, and providing psychosocial support are key in ART adherence and patient management. Nurses must assess and monitor respiratory status, administer oxygen, educate on ART, and refer to social services. The NCLEX tests your ability to recognize deterioration and advocate for patients. Thank you for using NCLEX MAP. Stay confident and trust your clinical judgment.